Okay, hi, it's Dr. Buford. We're just getting started on your left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. You can see a lot of torn tissue here. This is superior labrum, and this is where the biceps anchor inserts. And so this is what we call a degenerative slap lesion. Your rotator cuff tear is actually right here too. Let me see if I can show you. This is the biceps tendon, that rope-looking structure. But you can see this is completely detached, and so that's got a particular name. It's called a slap lesion. So as we look above it, this is the torn rotator cuff right here. And so we knew and expected to see this, and this just confirms it. The biceps tendon we didn't know for sure, but now that we've seen it, you can see how long it takes to make that diagnosis, just a couple seconds. So what we're going to do now is take a spinal needle and pass it through the biceps tendon. There we are, going through once. We'll pass a shuttle, hold the scope. If you just hold the scope right there, it's perfect. We're going to pass a shuttle relay through this, and then I'm going to take a grasper. So 2 hands on the scope and just kind of keep me right there. Perfect. And so we're just going to pass that through. I'll take a grasper. We're going to retrieve the relay right here. I'm going to slowly back out. Can you turn up the brightness on the monitor, please? On the light box. And now we're going to load that relay with a suture. A little bit more. We'll go up more. Okay, that's good. It may be our control here. We'll fix that. And we'll pull back. Yeah, that's great. Thank you. And as we pull, you can see how it brings that first suture through. We're going to repeat the process one more time. Can you just be checking and make sure we have a 3-5 pop lock in case we need it later? Here we are going through the biceps a second time. Go down one on the brightness. Yeah, okay. And now we're going to, we'll show you that on the screen. Yeah, don't open it, just have it ready to go. And then once we feed a bunch of this black wire, again, that's called a suture shuttle or a shuttle relay or a super shuttle. It's had a bunch of names over the years. But the bottom line is this is what we use to move suture back and forth. So now we're going to go ahead and we're going to stop there. Instead of pulling it straight through the cannula, if you watch closely here, you'll see me back the cannula up behind the biceps this time. And now we're going to retrieve it. You'll see why in just a minute. And so now we're going to load that suture. Here you go. We're going to load that suture one more time. And now as we pull, you can see how it's bringing that through the biceps a second time. As we pull tight, see how now by going around the biceps and back, that gives us a loop all the way around. So watch as I pull tight. Watch what happens. See that loop? See how it snugs that? So now the harder I pull on these sutures, the harder it pulls on the biceps. That's called kind of a purse string suture. So I need the arthroscopic scissors. Perfect. Now that we have the bicep secured, we can go ahead and release it with a pair of arthroscopic scissors that you see right here. And that way, we don't have to worry about this labrum being pulled off the bone anymore, because the thing that's pulling it off is this biceps tendon, and now we're going to release it. Okay, so see that? So now the biceps is gone, it's secured, the labrum no longer has something tugging on it, and that should be fine. I'm going to use my shaver, I got it now, just to smooth out anything else that we have here. Okay, we'll put our blue cannula back in. I don't think we need to actually repair the labrum here because we removed the biceps Okay, so that looks a lot better to me. Now I'm going to look around the rest of the shoulder. I'm going to rotate the camera, look towards the back. This is the posterior shoulder, posterior capsule we can see. Try and see if you can lift straight up on the shoulder for me for a minute, just straight up. You can see here you've got some labral degeneration here. So we'll try and work on smoothing this out a little bit. This is, again, just a sign of shoulder arthritis, really. Not so much instability, but just arthritis and degenerative changes. That's a better look at it now. Okay. Okay, so I think we're done debriding inside the shoulder. Give me one more scope, please. Scope, one more scope, the 30 degree. And this is the rotator cuff tear towards the front. We've already started debriding this from the articular side because it's really easy to see here. So where my shaver is right now is literally right where the rotator cuff is pulled off the bone. This is the edge of the rotator cuff right there. Okay, so we're going to stop here. We're going to get to work up in the subacromial space. Okay, so what you see here is the tear in the tendon. I'm going to place the spinal needle down just to help me plan my anchor placement. And just for orientation, the back of your shoulders to the right, there's a cannula coming in there. The front of your shoulders to the left, that's this cannula here. Those sutures you see are the ones from the biceps. There's two of them right there. And this is the tear in the rotator cuff. And so the articular surface is right here. If we kept going this way, we would go down into the shoulder joint. See, that goes down into the joint. Down there, there's the glenoid. Okay. And so we're going to place an anchor about 5 millimeters back, so maybe right about here. Somewhere right about here. We know that the entire footprint will be restored with a good single row repair right about there. So we're going to take a scalpel. Go ahead and pull that. And then hold the scope. And then we're going to take our guide for the anchor, the metal guide. Okay, so we've got the anchor placed. This anchor has 3 sutures on it, what we call a triple loaded anchor. We'll pull back on it. That feels pretty good. We're going to take out one of the sutures out the front, which is on the left side of the screen, because we're going to start suturing from posterior to anterior, from right to left. So we'll take out this solid one first, right there. We're going to leave those other ones alone. We'll grasp her to Travis. Okay, so here you can see my suture hook. It's loaded with that black relay that you've seen before. There it is there. And now I'm going to use the grasper to make sure I'm getting the full thickness of this torn cuff. See, I can get underneath, make sure I've got that full width of it. We're going to sneak back here a little bit because I want to make sure I get a good bite this way also. And now you can see, pull back, yep, perfect. So you can see I'm all the way underneath, that looks good. So we're going to go ahead and feed the relay. I'm going to grab it here. And then outside your shoulder, we're going to load that into the relay, load the suture into the relay. So, okay, so now as we pull back, you'll see that suture go underneath. That looks great. Comes out right there. We'll go ahead and take the crochet hook and get the partner suture, which is going to be the same color. So now that gives us our first suture loop. The question is, do we tie it now or later? I think I'm going to go ahead and tie these all at the end. We'll go ahead, just because it makes it easier to see. So we're going to go ahead and get the next suture in line, which is this blue and white striped one. I'll pull that out. And now we're going to take a slightly different curved hook and make another stitch. Okay, so now we're holding on the edge of the cuff as gently as we can. And we just want to see how it reduces. And it looks like if we get it back here, that's going to be reduced nicely. And so now that we know that, hold the camera right there, we can take this curved hook, we can come back a little bit lateral to the muscle tendon junction. And there it is, just coming underneath. So I'm happy with that. We'll go ahead and feed that through. Pause. Yeah. Hit it longer. Hold it longer. Okay, so we are tying these knots one at a time, and then if you can, slowly the move is kind of that way. You can see is hold right there. As I pull tight, see how that brings that tendon down to the bone. And now we'll just finish the knot right there. We'll show you some more in a little bit. Pause. Hold it down a long time. Okay, so we're done with the repair. Let me just show you. We've got all sutures tied. You can see how that's been repaired back to the bone. The bicep sutures are tied up there. We're going to do our last little biologic trick here, which is to tap. Go ahead and tap down. Open up the greater tuberosity here to let some of the marrow elements out to help this thing heal a little bit farther, just down to the, yep, perfect. So there's one hole. For this size tear, I think we can get by just making a couple. First one's right there. You can already see the marrow elements starting to come out. I think we'll do another one just right here. Good. Okay, so that's two. I think that's enough. I'm going to turn down the pressure, and we're going to finish up here, okay? So good luck to you now. Bye-bye. Let me get the shaver.